Hi everyone, this is Dr. Badawi from Westlake Dental Care. I'm recording this video because a lot of my new patients keep asking me this question over and over and over because they're nervous. How painful is the implant process? Well, everybody is different. The general population really expresses that there is little to no pain after the implant is placed. And I'll explain this. Before the procedure, the only thing that is done is an X-ray and an exam. The X-ray doesn't hurt. The CT scan doesn't hurt. That is typically painless. The next procedure is the actual implant procedure. The surgical part where people ask me, am I going to feel the implant going in? Am I going to feel any pain? What do you have to do? And so for this part really, all you need is local anesthesia. Some people choose to be sedated. This is typically not necessary. You can have different types of sedation. There's deep sedation, IV sedation, or you can have an oral sedation, conscious sedation, which we offer here at Westlake Dental Care. We offer nitrous sedation, which is the laughing gas. You don't have to have somebody to drive you afterwards. You don't need to have an escort after laughing gas or nitrous sedation. And we also offer it in combination with the pills, which is the pills that you take to calm your nerves down. This is a level of sedation called oral sedation. So local anesthesia means that you get the little numbing gel on your lip or inside your lip where the dental injection will go, where the local anesthesia will go, lidocaine or whatever anesthetic I choose to administer for you at the time, depending on the case. So you get that numbing gel to numb the area where the injection is going so you don't even feel the needle going in. I've had many people ask me, did you already give me the shot? Did you already start? Because I'm able to actually not make you feel the injection going in, and then with some other ways we can actually make you not feel the injection at all. But it's just an injection in the gums and you wait for a few minutes. Once you're completely numb in that area, then the implant procedure takes place. During the process, you will feel that the doctor is applying pressure on the area, but the most common complaint I get is that there's too much water and sometimes some water can be sprinkled on their face. So just to give you an idea of the level of the pain, the patients are not caring about how it feels, they're more worried about the water, if anything. And so during the incision in your gums, you're not feeling a whole lot besides the pressure that the doctor is applying. The local anesthesia is very reliable, and patients don't feel a whole lot besides some vibration from the drilling when the drilling takes place. Again, you just feel a lot of pressure and some spraying of salty water. We use a saline solution while we're drilling to cool everything off. Then the doctor places the implant, and when the implant is actually going in, you will feel some pressure. Just a small amount of pressure and for a few seconds. Then the gums are closed with a couple of sutures, which again you will not feel because you're already numb. And then you will be prescribed some pain medications and antibiotics. So now we get to the third part. What does it feel like the night after you place the implant, or even the next day? Well, most of my patients take a Motrin and a Tylenol that evening. And that's it. Most patients report that they don't have to take any more ibuprofen or acetaminophen. Most patients do not even receive the Tylenol 3 after the procedure. So I typically just prescribe the combination therapy and antibiotics, and that's it. And I really don't have many complaints that the patients had pain. So if you're thinking about, well, I have to go back to work, how many days do I need to take off from work? If you don't work on a Saturday or a Sunday, then by Monday, you will be just fine to go back to work. So the next part is in 3 months. That's when you receive your permanent crown. If your implant was covered and not had a healing abutment placed at the time of surgery, and it was completely covered under the gum, then that second stage surgery will occur. Now, it sounds scary because of the word surgery, but if you've ever had a biopsy done at the dermatologist, they use a circular punch that looks almost like a hole puncher. And that's what they use to biopsy the skin. We use the same thing to make a little circular incision in the gums over the implant itself. The healing abutment, which is similar to placing, let's say, an earring that you can remove and replace without having to numb it. So during that second surgery, again, you will only be giving a local injection and prescribed no medications during that visit, only some saltwater rinses. I hope you found this helpful. Dental implants don't have any pain at all, except the injection. And if you have a good surgeon, you will not even feel that. So I hope you found this informative and it calms your nerves about the dental implant process. This is Dr. Badawi from Westlake Dental Care. Have a great day.